The reason that I started Circle of Health International is because I saw a real need for a small, nimble organization focusing on women and reproductive health in war and disaster areas. The big organizations like UNICEF and Save the Children do a great job, but they're sort of behemoth, and it's hard for them to turn and to respond quickly to needs as they arise.
We take for granted here in the United States as well as the developed countries that whenever a woman is ready to give birth, that there's going to be a birthing center or a hospital nearby in which she can do that. When I traveled to Tibet, I traveled to some remote areas where there is nothing for miles, and the environment, the weather is very harsh, and so these women have to be able to help each other in the birthing process, and you don't have something down the street where it's easy for you to give birth. And we had the opportunity to visit a birthing center, which was really my first time ever being at a birthing center. I met the midwife that ran it, and it was inspiring. They brought the Palestinian women as well as the Israeli women together in this truly beautiful cooperative effort. And so it just sold me more on the ability of this small organization to make a big impact. They bring these women together, they train them in midwifery skills. These women then become the trainers. They go out into their communities, they spread the skill set, so then when you get into remote areas of Palestine or Israel where they don't have access to the care that we have here in the United States or more developed countries, these women are the ones that go out and help in birthing the babies or doing checkups during the pregnancy.
So the challenge is that Austin is awesome in supporting Austin, and so my hope is that we can do a better job of telling our story about how we also see ourselves as being based here in Austin and part of that local flavor, even though we serve a broader population. What I know about Austin is that it's an entrepreneurial place where people can come and make their dreams come true. And this was my dream, to have a small, nimble, flexible, committed grassroots organization that can respond to big emergencies in the world.
And the need is basic. It's servicing women who are in need of midwifery and birthing services. So a woman here in Austin having a baby is the same to me as a woman in Tibet having a baby. It's the exact same experience. It gives me a lot of gratitude to be able to support a local organization that really has a worldwide impact.